1 million Americans are living with Parkinson's disease, but a newly expanded treatment is changing the game. Doctors are now using ultrasound tech to target some of the most debilitating symptoms. There is one man who lived with a severe tremor for years, and after undergoing this treatment, the shaking was gone within minutes, and no surgery was even required. That patient, Air Force veteran Bud Leavell, and his doctor, Dr. Bhavya Shah, join us now. Good morning to you, gentlemen.
Good morning.
Good morning. Bud, I'll start with you. I know you had stage 3 thyroid cancer. You had surgery. 1 hour later, your voice started to change and you started experiencing the tremors, and you were diagnosed with Parkinson's. So a very tough time in your life. But now, because of this ultrasound therapy, no more tremor. How did that change your life?
Oh, the tremor made it really difficult to do a lot of things that I enjoy doing. I'm an outdoorsman. I like using binoculars. The tremor made it impossible. I really enjoy working on antique radios. When I say antique, I mean really old stuff. And they frequently require a lot of work, but it's fun. The problem is, with that tremor, I couldn't hold a soldering iron still. And it made it very difficult. Dr. Shah fixed all that. And I don't mean a few minutes after the procedure, this was gone. It was gone immediately, and it's still gone. And in fact, I can show you, if you want to see, there's no tremor. It's gone. And so my life is more or less back to normal from the standpoint of what it is that I'm able to do.
Wow, Bud, what a blessing. Dr. Shah, thank you for changing his life and being a physician and caring for people. This was your first patient that you've treated with ultrasound therapy. What was your reaction when the tremor's gone immediately, being your first patient, and how does it work?
Yeah, well, so initially this was FDA approved for essential tremor in 2016, and we've done well over 400 cases for that. In January of 2026, the FDA approved an additional target in the brain for Parkinson's disease. That target was the pallidothalamic tract. And Bud was our first patient who we treated with the new target, the pallidothalamic tract. We were very excited that it worked as well as it did. The way this works is that there are multiple ultrasound transducers all around the skull, and they each send their own ultrasound beam that crosses the skull onto a specific point in the brain. And that's where you get the maximum energy deposition. While we're doing this procedure, we can use the low energy ultrasound waves and then go examine the patient and make sure that their symptoms are getting better and that they're not having any side effects. And with our partnership with our movement disorder neurologists at UT Southwestern, that's really how we do this procedure. We map the patient's brain, we identify the target that is most likely to help with that patient's specific set of symptoms, and then we go ahead and deliver the low energy ultrasound waves. Our neurologist examine the patient on the table. It's part of a multidisciplinary approach that we think is really important to the safety and effectiveness of the therapy.
Who is eligible for this? At what age? Is anybody eligible that's diagnosed with Parkinson's? And how long does it last?
Yeah, so, how long does it last is a great question, because this is a relatively new technology. So we don't have long-term data yet. We know that it is effective. The longest term data we probably have is about a year or a couple of years. I think it'll be interesting to see the landscape as how this technology evolves over time. Who's eligible? Well, so somebody who has Parkinson's disease, someone who's tried medications, the medications are either not working or higher doses are causing side effects, should see a movement disorder neurologist. And a movement disorder neurologist can then very quickly walk through all of the different treatment options, whether it's changing medications, whether it's another surgery called deep brain stimulation, or focused ultrasound to really decipher what's best for that particular patient.
Bud, what is your advice for other people that are going through this that have Parkinson's?
Well, I would say don't run to your nearest movement neurologist and get evaluated. Find out if they can help you with that. We're all different. And so it's not going to be possible to say everyone qualifies. But I would hurry up, find out if you're available and get it fixed. And you know, the whole idea of having at least the symptoms of Parkinson's disease suppressed to the point where my life is more like normal, it doesn't get rid of the Parkinson's, it's still there, but life is normal again. And so don't wait, call now and get started, get on the list.
It's amazing. And we're talking so much in the news now about AI and how that's going to transform medicine. So this is all great news for the future. God bless you both. Thank you. Congratulations, Bud.
Thank you.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.